Okay. So
it could become
do you
a regular
want to,
thing.
let's have a little talk about what's ethical and what you should like what is a good, like, hold on a second, let me move, because I'm just surrounded by this lawnmower, so I can't get away from it. Leaf blower.
Sure.
So let's talk about some things that you would like recommend people look for that are good things, like 10 good things that every rehab should supply and give to you as your rehabilitation, you know, and like 10 bad things, 10 things that are no's, you know?
Okay. So, perhaps if Travi, for instance, ever decides that he needs to get some help, where would he turn to? How would he know? How would he know the right place to go to dry out or get a new perspective?
Yeah.
So, all right. So the first thing, if you're just like blindly looking for, say, like a drug rehab or treatment center. So, like, say you're online and you want to make sure, first of all, that the name of the treatment facility is mentioned in the advertisement, like the name itself, not something generic. Because if it's generic, what that means is it's being advertised by like a lead generation call center, or like a third party that isn't actually affiliated with the treatment center or plan.
Right.
And
so
they're going to refer you to some unknown place that they don't even care about because they're going to get a kickback on the referral.
Yeah.
That's the first thing. All right. So, and then you want to find out where the place is located and if it actually matches the location that's being advertised. Because in a lot of cases, again, they'll say, like, treatment center in California.
Yeah.
And you'll call up and they'll divert you to the treatment center in Idaho. Because again, it's not actually affiliated with the center itself. And that's pretty common. Because there's a lot of money to be made in referrals. So, okay, so once you verify that, you want to find out if they're licensed, but also accredited by the Joint Commission. It's an accreditation body for rehab facilities. It's a legitimate. It's called CARF, and I don't remember exactly right off what the acronym means, but you'll ask if they're accredited by the Joint Commission or CARF. And what they do is they assure certain standards of care are being met. Like one basic one is that the cleanliness of the place is up to hospital standards.
Yeah.
So that's good to know. So now you're like, if these things are checking out, you're getting into a situation where you're likely to get something that's real and helpful. So if that's the case, then you find out about who the owners are, their backgrounds, individual licenses that they hold, because you can own a facility and really not have anything to do with it. Take like Promises Malibu, for instance, right? Where the kid died, right? That was the guy who was they advertised on television like that you come here and then you're not a drug addict anymore and you're cured.
Yeah.
Well, the son in the father and son team OD'd and died.
Oh, well, that's
Yeah.
lovely.
Yeah, right. So we don't, you don't want that, because what happens is, I mean, there are people who go to treatment centers and kind of take stock in deciding that, it's a good way to make money, right? Like they're in the treatment center and they look around and go, wow, like $1,500 a UA.
Yeah.
I could do that. You gather up financial resources, open up a treatment center, treatment program with maybe perhaps only minimal clean time themselves. You call it giving back, but if you're profiting from that service, it's certainly not altruistic.
No.
You know, and you want to find owners and operators who have either are or both licensed and accredited and or have a long period of abstinence and like drug and alcohol recovery themselves, because those kinds of people are going to know what's needed and what worked for them.
Yeah.
Okay. So,
can I ask you a question, Marcus?
Yeah.
And I mean, like, I don't want to throw you under the bus as someone getting into this industry at all. So please don't mention names if you don't feel comfortable. But
sure.
Are there like five top worst places to go?
No, there are far more than that. I mean, just about every other place is the worst to go, and the reason is because they're not meeting these check marks on this list, and sometimes it's really difficult to determine, because what happens is, like, family and friends, loved ones, they want to get their guy or girl better, you know, and so they'll just go with whatever.
Yeah, I'm pretty familiar with that method. Yeah, Marcus, I do remember this.
Right.
Yeah.
As we go on, so those are the first 4 points. Then you need to find out, like, who the actual, like, providers are. Like, who's going to be providing the therapy? Are the clinicians, psychiatric services? What are the methods of treatment? Are those people trained and licensed? Like, the idea is, like, consider where you would go for a medical problem, right? Say, like Chunks with his diabetes, or some other guy with a broken arm, or surgery. So you wouldn't go to the diabetes guy for your broken arm. Like, you would go to the broken arm guy. And there are different methods of treatment that are more viable than others, or more effective.
Sure.
So you want to find out what they do and how well they do it.
Right.
If it sounds too good to be true, and then you probably want to stay away from that. If the treatment center doesn't have if they don't list, like, their clinical staff on their website, for instance, like the counselors or a nurse, like, if they're not included in the advertisement itself, then it's probably a big red flag. Because you want to be able to look these people up to find out if they're legit.
Right.
All right. So then most of these things accept insurance. So they should be talking to you on the phone about deductibles, copays. That's really the standard aspect of most care. Like, just like a hospital, they need to talk to you about what your insurance covers.
Sure.
Now, if you find that things are being waived, or that, we don't, we're in the sense of what your insurance covers, they're not they're not including in that, and they're just kind of saying, "Oh, we don't need to include that. We're going to waive that." That's no good, because they're just trying to get you in the door and make money, regardless of what kind of insurance coverage you have. If you have crappy insurance and it clearly doesn't cover what they attest to be the treatment they are giving you, then they're probably not really giving you that kind of treatment. They're just saying so.
Right.
So a lot of these places, they offer like incentives, like free cigarettes or even cash. That's illegal. In fact, there are people who go into treatment as a profession. Like, you spend 10 days in the treatment center through a broker. The broker gets a kickback, and then the broker, after like 2 weeks, pays the client half of what they make, and the client leaves, and the cycle starts over again. So that's real. That really happens.
How does that work, though? Like, who sets that up?
Because the treatment center gets the insurance money for the so-called treatment. They give up to literally $3,000-$4,000 a client to the broker. The broker then kicks back that money back to the client.
Holy shit.
Yes, so everybody's getting paid. And this isn't always the case, but it certainly happens. And it was really bad in South Florida up until fairly recently when they started cracking down. And now California is kind of the hub where it's really difficult to police because of all the conflicting pressures. Like, I mean, there's an opioid epidemic, and so people are like, "Yes, help my kid, help my wife."
Yeah.
You know. So another important thing is to determine, like going back to the Charlie Sheen image of his mansion, are the pictures promoted in the marketing materials the actual treatment center?
Right.
Because that happens too.
Sure.
They'll show these great buildings and vistas and, you know, all this cool stuff like the indoor pool.
Yeah.
And you show up to some place that's not at all that. Right.
Yeah, I had that experience with going to Texas when I went to Texas. I remember they had showed me a couple of pictures on like a brochure or something. It wasn't anything like that.
Right. Yeah, that's a big deal. And then if all this is like checking out and you're getting good answers, you want to find out about as clearly as possible what are the specific percentage of successful outcomes. Like, how do they keep track of treated patients, and how do they know that their methods are working long term?
Right.
They should have data on that. And if they won't offer any kind of real number, and it just sounds like something ridiculous, like 80% of our people have like long-term recovery. It's probably and with nothing to back it up, it's obviously a big red flag.
Yeah.
The final thing really is that if you're using healthcare insurance, you find out what the facility or program does if the insurance carrier stops approving treatment during your stay. So if you have a mandatory minimum, like a 30-day program, an ethical center will not rapidly discharge patients who are unable to pay simply due to their insurance company stopping coverage. You should still be gently transferred out, and there should be a contingency plan for that kind of thing because it happens. Like,
Sure.
you know, you go in for 30 days and you're on day 40 and your insurance company stops payments. That should not be a disincentive to stop treatment, because
Right.
these places make so much money that they should be able to afford it. You should be totally able to eat some of that. And
Yeah. Yeah.
right. And so there you go. There's like the pro and con. Like I kind of did it both, you know, at the same time.
Yeah.
But what to look
Yeah.
for and what not to look for. And if all these things line up, and you're probably going to get, you know, reasonable, doctor approved, like addiction as a disease model treatment. And, you know, included with that is like cognitive behavioral therapy, you know, like, or talk therapy with counselors, along with frequent medical evaluation, along with life skills classes, because, you know, people are coming in devastated, you know, and people don't even know how to go grocery shopping anymore, for instance, like, or resocialization, like how to relate to people when you're not under the influence. Like, these are all challenging things, but within a fairly short amount of time, you can reteach people how to do these things. And so there are, you know, despite the fact that this stuff is incredibly expensive, maybe, you know, and maybe even for good reason, because it should be pretty intensive. I mean, at least the therapy, and that costs money.
Of course. Yeah.
Even though places may be expensive, and especially if they're expensive, you should be getting your money's worth.
Yeah.
So yeah, that's my take on it.
So does your place have a psychiatrist?
No, not a psychiatrist.
Okay.
We have licensed clinical social workers.
Okay.
With master's degrees.
Okay.
You know, real counselors.
Yeah.
I'd say that 75% of the staff is in long-term recovery themselves, so they've been there. You know,
I think that's really important.
Several of the people who work on staff have also been clients.
Yeah.
Which I think is a good thing.
Yeah. Absolutely.
Or can be. You know, it can be. Yeah, and I noticed positive outcomes all the time. Like, we don't see these people for very long. Like, you know, 2 weeks to 2 months generally.
Sure.
And they get kind of leveled up, like, as far as like their beneficial restrictions, like, come in, you're detoxing. So we're going to take away the distractions. We're going to take away your mouthwash. We're going to take away your hand sanitizer. You know, right?
Yeah.
And because we don't want you to drink it, and we're going to take your cell phone. You can make phone calls. You can make 2 necessary phone calls. There's going to be a staff member with you while you do that, because some people need to call. They need to call their family. They need to call their work. They need to call. Sometimes they need to call their lawyers.
Sure.
So we don't prohibit people from doing what they need to do, but there are some restrictions in place so that you're not distracted from why you're there. And one of the things that I always go ahead.
Well, you're protected too that way, because you have people in your cell phone clearly that you could call who are not good for your life, probably too, right? I mean,
sure. Well, sure. I mean, people want to call their their, their girlfriend. And we're not
Sure.
opposed to that.
Yeah.
But we want to be there to make sure that you're okay on the phone with your girlfriend, because that could be I hate the word, but it could be a big trigger.
Sure.
To, wanting to get out of there, wanting to leave, or wanting to like stop the process, stop the treatment because she convinced you to come home. Because these people come from all over the country,
Of course.
There's some of these first time on an airplane, in some cases, and it's all very exciting, but also really it can be really nerve wracking, especially if you're detoxing off of like 5 or 6 different substances.
Sure.